Welcome to the Dr. Nurse Paul Show, hosted by Aspire RN and Dr. Paul. You are watching The Secrets of Next Generation NCLEX. Dr. Nurse Paul is an NCLEX expert, having trained and mentored thousands of international nurses past the NCLEX RN for over a decade. He graduated with a Doctor of Nursing Practice in Texas Christian University. He is a registered nurse, an advanced practice registered nurse, and a certified family nurse practitioner. He also has completed a certificate for nurse educator postgraduate course. Aside from teaching, he has extensive clinical experience in emergency and family medicine. He has over 15 years of combined clinical and academic healthcare experience. Dr. Nurse Paul is an immigrant from the Philippines. He is currently based in Houston, Texas, where he operates his business, Dr. Nurse Paul and Aspire RN NCLEX Prep. He loves to share his life story of how he overcame his challenges to reach his dreams. He is passionate in helping nurses realize the American dream. So without further ado, let's all welcome Dr. Nurse Paul.
All right. Good morning, anyone. Welcome back to the Dr. Nurse Paul Show. And today we're live streaming from all the way from Houston, Texas. And this show is being live streamed on my Facebook pages, YouTube, and LinkedIn. All right. So we had to suspend the Secrets of Next Generation NCLEX for the whole month of May to give way to the Nurses Month events. And the Nurses Month events were very successful. We've mounted more than a dozen shows. I was in more than a dozen shows during the Nurses Month. I really devoted my time for the nursing community. And we have given out a lot of prizes. We have given out more than 20 Aspire RN and NCLEX courses across our raffles beginning at the 1st of May till the 31st of May. We've also given 4 UWorld subscriptions, 5 IELTS Unlimited Review courses, and 5 $250 vouchers. Plus, we've also run for a week a 50% off on all our courses. So we've given a lot to the nursing community, and that was my goal for doing the Nurses Month. Thank you, everybody who've joined us. It was very successful. We have a lot of viewers in that show. All right. So where is everybody coming from today? All right, let me just share this to the page, because I forgot to share this to the page. I was rushing to get to my desk because my coffee was taking a while to brew. So let me just share this to the pages that I administer. One second. All right, and I'm almost done sharing this, just putting a little caption. Sorry about that, guys. I was running late because I was still responding to quite a few messages from my team members before coming on. But here it is, and my coffee is already here. All right, it's been shared already. All right, Amina is joining us from Guyana. Thank you for joining us. Rose is also from Guyana. Rose is also one of our winners for the full NCLEX course last month, right? All right, and Armeline said, when is the show starting? We have just started. Arlene is here from Jamaica. Thank you, Arlene, for joining us. I really wanted to go to Jamaica. I was thinking about it the other day. All right, so today we're going to do the Secrets of Next Generation NCLEX. I have a fresh case study for everybody today. You guys are going to help me answer this case study today, okay? All right, so we're going to start that in a little bit. All right, but then again, I would like to thank everybody who has joined us during the Nurses Month. There were so many things to celebrate during the Nurses Month, but I had to focus on the Nurses Month. It was also my first year graduation out of the doctorate school, but it was also the 3rd year anniversary of Aspire RN, and we have featured Aspire RN in one of our shows. But thank you so much, guys, for joining us. in all our shows so far. Thank you for continuously supporting Dr. Nurse Paul in my social media pages. Please don't forget to follow me on TikTok, Instagram, and also YouTube and LinkedIn. If you guys have time, please follow me in all those social media pages. And I've been incredibly busy for the month of May, but we're gonna push out more contents for our reels and for our TikToks. Short videos is what we call that, right? And then of course we're still gonna do the shows every Saturday. All right, if we have the schedule for the month of June, if we can just flash that. But we have 4 shows this month of June. All right, so please join us with that. And we're gonna show this again later. All right, I'm still waiting for more people to join. Hello, Kay. Kay is here. She's one of my social media team. She's the one operating the Dr. Nurse Paul social media pages. All right, upcoming Dr. Nurse Paul show. We have June 3, which is today, the case study, and June 10 next Saturday. We're gonna talk about English exams for immigrants. So there are different English exams. I will bring in my good friend Irvin Neil Temporal from Niners 9.0 Niners to talk about the different English exams and why is it important when immigrating to the USA. That is on June 10, and I will be live streaming that show in London. All right, so we're gonna see that show being live streamed in London. I will be in London that day. All right, and then June 17, I'm gonna come back for another Secrets of the Next Generation NCLEX. And on June 17, I'll be live streaming from Copenhagen, Denmark. All right, so I'm gonna live stream from Denmark on June 17. We're gonna do another case study. All right, very excited to do that. And on June 24, to cap off the month, we're gonna talk about understanding your job offer, and I will be inviting Ron Hope from WWHSS. All right. And I will be live streaming the June 24th show from New Orleans, Louisiana. It's going to be an incredibly busy month for me. All right. I'm going to be traveling around Europe and then coming back to the US for the last week of June for a nurse practitioner conference in Louisiana. So if you guys are in those areas that I've mentioned, let me know. I want to see you, nurses. I want to collaborate with you, do a little interview, and feature you on my social media in all the cities that I'm visiting. I already have a couple of nurses approach me that they're in London. So I'm going to meet them so I can interview them and just talk about, success stories, achieving your dreams, something like that. All right. And that's the passion of Dr. Nurse Paul, why we put up this show to kind of like inspire you guys to dream and be a better version of yourselves. All right. So, and I'm so excited to do this today because we haven't had a case study in the last month, right? So we're back with another next generation NCLEX case study for today. Michael is one of our avid viewers. Thank you, Michael. Greetings from Bohol, Philippines. Please tag your friends, guys, so they can join us. All right. Don't forget to tag your friends so they can discover Dr. Nurse Paul. There's a wealth of information in all the shows that I've done thus far. So I started this show back in October. It was my birth month. All right. And today we are celebrating how many months? 9 months of Dr. Nurse Paul show that we guys are together every week. And I've had a couple of shows that I missed because I was either not feeling good or I was somewhere else that I can connect to the computer. And, I love to travel. But thank you guys for being with me in the last 9 months. All right. When I started Dr. Nurse Paul as a brand, I was just using it to share inspirational stories about my life, about how imperfect my life was. But I used those imperfections and challenges to power me through life. And it has grown since to, we've invited tons of people who have shared their immigrant stories, their very inspiring stories in my show in the last 9 months. And in October, we're going to be celebrating our first year anniversary Dr. Nurse Paul show. So it's going to be something big again. All right. We're in the planning stages already. So we're going to talk about that very soon. But for now, we're going to resume all our shows every Saturday. So please bear with me. I may be somewhere else during this Saturdays, but we're going to continue doing the Dr. Nurse Paul show because I am very passionate with providing free education and information sessions to you, our nurses all around the world. We're going to have very important guests on all my future shows. I'm also going to be inviting a few NCLEX instructors on my team to show you guys how we do it in Aspire RN. As many of you guys already know, I'm the CEO of Aspire RN, and that's my business. We do NCLEX review program for internationally educated nurses, and we have very high success rate, 98% pass rate back in 2022. And in the next gen NCLEX, we have 100% pass rate, and we are currently tied up with 5 sponsoring agencies that are bringing their nurses to us. Thank you guys for everyone, and I think we have good number of viewers today. Thank you guys for continuing to support Dr. Nurse Paul. Thank you, Mary Joy, for tagging your friends. Good morning, Gia, and thank you for joining me today. All right. And of course, we're going to talk about secrets of next generation NCLEX. Anyone here in the audience that will be taking the NCLEX very soon? All right. Anyone here? All right, so I did a show yesterday. If you guys can go to my Facebook, I think I've streamed it in my Facebook and YouTube. I did a show with Kinetics USA. It's called NCLEX Heroes or Success Heroes, where we featured 5 Next Gen NCLEX passers from Kinetics USA and Aspire RN partnership. And they have shared very valuable thoughts, information, very valuable tips straight from people who took the Next Gen NCLEX. One of them is Carolina, and she shared her story about how she failed the exams in the past, and now she felt like Next Gen NCLEX was much more easier for her compared to the past exams. All right. Kim is taking his exam on June. Good luck, Kim. Hopefully, this case study will be able to help you dissect those case study. While I discuss this case study, this is a pretty long case study, guys. So hold still, hold your horses, all right? And we are gonna go and discuss this case study in a little bit. This is gonna be pretty long, and I've studied this last night, pretty intense. As far as the content, it's huge and massive content or information. But hopefully this will help you, Kim. I'll also discuss some tips along the way as we answer this question that might help you. All right. And Romel is joining us from the Philippines. Romel is also one of our avid viewers. Thank you for continuing to support Dr. Nurse Paul. All right, let's get down to business. Are you guys ready to take the quiz? If you guys are going to pass the NCLEX, can I see a yes, I can in the comments? Say yes, I can if you will pass the NCLEX. All right, yes, I can. I just realized that I got my NASA mug and my NASA shirt. I'm from Houston, guys, and the mission control is here in Houston, and that's my favorite museum here in Houston, Texas. If you guys have watched Apollo 13, where they say, Houston, we have a problem, right? That's Houston. So you have, I think, the Johnson Space Center here, where we have the mission control for all the space activities. But anyway, so I'm a fan of NASA, obviously, and I don't know if you guys see the Artemis. Oh no, not the Artemis. I'm sorry, I thought I had the Artemis. I still have to build my Artemis Lego because it's massive and I don't know where to put it. But I don't know if you see in my side. That's the commemorative space shuttle. If you guys are familiar, that's the last project of NASA before Artemis. All right, and that's for you guys, science geek. I don't know if you guys can relate with me, but I'm a fan of NASA. Anyway, so hence explains my mug and all that. All right, I guess everybody's ready, and we are going to start with a case study today. After this, actually, I still have to jump on a class. I have a Next Gen NCLEX case study master classes with my students, and we do master classes every weekend. It's 4 weeks, 8 sessions, Saturdays, Sundays, and we do about 30 to 40, actually 50 case studies in a span of 4 weeks. That way, by the time my students come in for their NCLEX and their actual NCLEX dates, they would be very comfortable. All right. So that's what we do for our students in Aspire RN. And I teach the NGN master classes myself. All right. You guys ready? This is gonna be 6 questions about a certain case study. All right, and let's begin. Please tag your friends so they can join us today. All right. I know some people come in late. They would join during the tail end of the show. But anyway, this show is recorded so you guys can see this or repeat this or tag your friends or share this to your pages. All right. Can you guys do that for me, please? If you can share this to your pages so we can reach out to your friends and your network. If you can just share this, repost this, I would really, really appreciate that, guys. All right. All right, here's our case study, and let's read the case. All right. So I was trying to figure out how I can zoom in the screen. All right, but let me set up my iPad because I can read it myself. But you guys can see the screen. If you are using your phones, you can zoom it in. All right. If you're using a computer, I think you can do Control Plus. If you're using a what you call that, Windows. If you're using a Mac, it's Command Plus. All right. So let me see this. Let me just connect my iPad real quick so I can read it as well because my camera is a little bit far from me. All right. We're going to read it together. All right. You guys ready? Okay. So here's the situation. Um, this is this is a patient, a 38-year-old female client. Okay. The nurse in the outpatient clinic is caring for a 38-year-old female client. Clinic visit, day one. 13 o'clock. Client reports pain in left ear. All right. Okay, guys, listen. This is going to be a very long case. All right. Can you guys start getting a notepad right now? A notepad or your phones to put notes. We will start writing notes. All right. This is one of the test taking tips I teach to my students. When you have a case study, grab your notepads right away. All right. Start writing. You know why? It will consume you time if you keep reading the case. When you go to the next question, you're going to have to read the case again, and the next question, you're going to have to read the case again. Let me tell you this. This is a very long case. This case will keep evolving towards the end. So start writing now. Write down only, listen, all right, to cut down time. Write down only the pertinent findings. When I say pertinent findings, that's your pertinent positives. For example, positive Holman sign or whatever, positive Murphy sign, whatever, or pertinent negative. Pertinent negatives are, for example, absent pulses. So all your abnormal findings you start writing down, in short, right? Start writing down. So for me, I'd write down the word left ear pain. All right. So it says here, experienced pain in the same ear last month, but was able to tolerate in the pain and self-treat with over-the-counter medicine. All right. Client is, welcome, Marinol. She just got in. Client is febrile with small amounts of cerumen observed in the left ear canal. All right. Patients already on azithromycin 500 milligram once today, then 250 for the next 4 days. On day 13, all right, this is 2 weeks later, almost 2 weeks later. At 9 a.m., the patient returns to the clinic reporting that left ear pain was reduced after azithromycin, but it recurred 3 days ago. So 3 days ago, the pain came back. Yesterday, client observes drops of blood in pillowcase. Reports bowel-colored emesis last evening after eating dinner. Reports having no oral intake today. Client states, I have not had an appetite for over a week. So I'm gonna write that down. I'm gonna write the bowel-colored emesis. I'm gonna write down the left ear pain again 3 days ago. Right? I'm gonna write down the no oral intake. I'm gonna write down no appetite. Client is febrile. I'm gonna write that down. Experiencing dizziness. Write that down. Vertigo and tenderness on the left mastoid process behind the ear. Write that down. All right. Purulent drainage observed in the left ear canal. I'm going to write that down. Tympanic membrane on observation or inspection is dull and bulging. What does that mean? There is an otitis media. All right. If the tympanic membrane is red, it is dull. All right. It is bulging forward. All right. That means there is an otitis media. So I'm going to write that down as well. Patient reports decreased hearing in the left side, obviously because of the otitis, right? Abdomen is soft but with hypoactive bowel sound. Last bowel sound was yesterday. Sinuses, chest, and throat clear without congestion. 12 lead EKG are normal. All right? Were you guys able to write down? Again, start writing down because this case is plenty. All right? It's plenty of information. It's going to be long. All right? But listen, all right? Be honest with me. Who among you guys get very, very what's this, overwhelmed when you see a screen like this? Be honest, be honest. When you see a screen like this pop up on your screen, by the way, this is how your NCLEX will look like. Same color coordination, same placing of your words. Who gets very, very anxious because it's plenty of information in your screen? Everyone? When I was a student, I would get anxious when I see the question is long, all right, or the situation is long. You got me? But guys, listen, think positively, all right? Remember that when you see long questions like this or long case studies like this, the longer the case study, that's one of the tips I tell my students, the longer the case study, the more clues you are getting. You got it? You just need to be patient with reading and understanding the case, but it's giving you a lot of clues. More clues means more chances for you to get the right answer. Do you guys agree? You guys agree? So do not get intimidated, all right? I'm still making sure that I'm still live because I haven't received a response for the last 2 minutes or 3 minutes. All right. So do not get intimidated if you get long case studies like this, because the longer the case study is, the more clues it's giving you, and more clues means more chances of getting the right answer. Agreed? All right. Now, considering all these things that we wrote down that are abnormal findings, like I said, start writing down because this case is very, very long. Which of the following findings require immediate follow-up? Select all that apply. Anyone? What's your answers? Select all that apply, by the way, is right minus wrong. So one of the tips that I tell my students is for right minus wrong types of questions, like select all that apply, only choose the things or items that you are 100% sure. All right. If there's hesitation or you're not sure, might as well not check it because it might be an incorrect answer and you will get a deduction for that. All right. So what are your answers? Give me the numbers of your answers. This is select all that apply. Do we require immediate follow-up for the vertigo, for the appetite, for the vomiting, for the headache, for the bowel sounds, and for the cardiac rhythm? I think it's safe to say let's remove cardiac rhythm, right? What's the cardiac rhythm? It's normal sinus rhythm. There's no issue. If anyone answered 6, you get a deduction. Let's remove that. 1, 2, 3, 4, 5. What are your answers? Do we prioritize bowel sounds? Everybody. Do we prioritize bowel sounds? Everybody. The bowel sounds is hypoactive. The last poop was yesterday, right? The last poop was yesterday. The bowel sound is hypoactive. The belly is soft. I don't think there's issue with the bowel. Let me remove bowel. All right, let me remove the bowel. Let's just remove it. All right. Hypoactive bowel sound doesn't mean there's issue right away. Sometimes they're just constipated. All right, I'm going to prioritize vertigo, risk for fall, lack of appetite, risk for dehydration and malnourished state, vomiting together with lack of appetite, then that's what? Elements for dehydration, right? And headache, because headache might be something neurological, especially we're close to the head, right? We're in the ear. Agreed? 1, 2, 3, 4. Who got this correctly? You get 4 points. All right. Okay. You guys ready for the next case? For the next question? All right. Okay. 1, 2, 3, 4. Next question will be same case. Nothing changed on your case. Look at your case. Same case. All right. Which of the following complications is the client at risk for experiencing? Which of the following complications is the client at risk for experiencing? Anyone? If you guys have social media like TikTok or Instagram, you can do a screenshot of what we're doing now or a little video and post it in your social media and tag me. Okay, tag me. All right. So leukopenia. Does anyone agree with leukopenia? What is leukopenia? Low white blood cell count, correct? Right? Sorry guys, I had to I need to turn off my phone when I'm doing shows, all right? Because when there are issues, I have to respond. All right. Hi Anna, good morning Anna. Thanks for joining. Anna is one of my good friends, also an admin of Lifora. All right. Leukopenia is low white blood cell count. Can this be related to this patient with infection? Guys, question, what's the major complication of infection? Anyone? What's the major complication of infection? Can it lead to sepsis? Agreed? Yes or no? Septic shock. You know, in sepsis, your WBC, what happens to WBC in sepsis? Anyone tell me? I know the answer here, but I want you guys to analyze because that's important in NCLEX. All right. When you have sepsis, your white blood cell count increases. Agreed? Sign of infection, but also decrease. In your SEERS category for sepsis diagnosis, you can both have increased WBC or decreased WBC for sepsis. Check it out. Check it out. We always think, oh, high WBC infection. What about low WBC? Right? Both of this can signify sepsis or high level of infection or inflammatory responses. So yes, we're going to choose one. That's part of the symptom because we're thinking about sepsis. How about paralytic ileus? Paralytic ileus is where your GI tract stopped moving. Well, if the patient vomited, let's account for all GI symptoms. The patient vomited with bile. All right. The patient has formed brown stool yesterday. The patient has soft bowel sounds. Right. I'm sorry, soft belly and hypoactive bowel sounds. Are these enough to tell us there's paralytic ileus? There could be a possibility, so we're gonna check it just because the patient has both hypoactive bowel sound and vomiting. All right, we're gonna include paralytic ileus just because of those two symptoms. We're not gonna rule it out. Remember, in step two, in question number two, we're doing differentials. All right, so we're gonna include all possible diagnoses. So if I'm the provider and I'm doing my differentials or working diagnosis, I'm still going to include paralytic ileus, which means I might still have to do more tests for that, blood tests particularly, and X-ray or CT scan, right? Because there's vomiting. There's vomiting and hypoactive bowel sound. So two. How about fluid imbalance? Yes, obviously because of vomiting, and everybody I think answered that. How about injury from falling because of your vertigo and dizziness? Very good. That's included. So one, two, three, and four. Five, venous thrombosis is not included. You get DVT from immobility or from hypercoagulability, right? And I don't think there's an issue here with hypercoagulability or immobility. Okay, so that's one, two, three, and four. One, two, three, and four. Okay, and we have we had suddenly we doubled our viewership in the last 10 minutes. Hello to everybody who is watching us. We are doing the Dr. Nurse Paul Show Secrets of Next Gen NCLEX, and we're doing a case study today. This is our question number 2, and we're about to go to our question number 3. All right, you can see the case study on the side, and this is how you will see it in the actual NCLEX. By the way, Anna said, I love Aspire RN, best NGN review center with Dr. Nurse Paul Biluan. Thank you so much. I do take care of my students and make sure they are prepared for the NCLEX. I'm a very hands-on instructor. I'm not only the CEO, I'm also the lead instructor for Aspire R, and I'm going to make sure that you guys pass. If you don't pass in my program, you're going to have unlimited review until you pass, all right? Even if it takes forever. At least in Aspire RN, there is forever. I'm just kidding. But the point is, I hope you don't review forever, okay? I hope at one point you pass the NCLEX. But the point is, the reason why I'm doing that is because the pass rates for international educated nurses are very, very low, all right? In the first 3 months of the year, first quarter, did you know that the pass rate is only 39% out of 21,000 takers? 12,000 people failed the exam. 12,000 international immigrant nurses like us, like you and me, have failed the NCLEX. If you are one of these 12,000 nurses, send me a message on Dr. Nurse Paul and I'm going to give you a good deal. I want to give you another chance in your American dream, okay? So do not fret. We're going to help you pass the NCLEX. We're going to make sure that we are going to use the most evidence-based program to help you pass the NCLEX. And we have really great success, especially for our students that have not been a nurse for 20 years or have not or have failed the NCLEX multiple times. I had a student who failed the NCLEX 7 times, guys, 6 times. All right, different students. They failed the NCLEX multiple times. We gave them another shot to their American dream, and now their immigration process is proceeding because they passed the NCLEX. So I want to give you that chance again. If you failed in the past, partner with me. I'm gonna make you pass. All right. That's the Dr. Nurse Pulse guarantee. You can check it in my website, aspirern.com. All right. Question number 3. Complete the following sentence by choosing from the list of options. The client is at highest risk for developing. What is this? This is a close drag and drop. I'm sorry, drop down. All right. Drop down. Oh, Bonnie's saying, I'm still joining you even if I pass last 2021. Yes, of course. You know, the good thing with the classes that I'm doing, it's open to everybody. All right. So, which means this can be a refresher for all of you guys as well. And Kiko, hi, Kiko. Kiko is one of my good friends, co-instructor since way back late 20, what is that, 2009, 2010, right, Kiko, when I first met you? And you're moving here soon to the US. So see you here. Gian is already here, one of my good friends. A lot of nurses are moving to the US now. So my goal in the next 1 year is to go through all 50 states and meet nurses and collaborate and do some contents with them, interview them about their American dream. So let me know, guys, what states are you going to. I might go there, visit in those cities, and interview you. All right. All right. So what's the answer here, guys? When I click the button, it says the client is at highest risk for developing which one? Meningitis, autosclerosis, or Meniere's? Considering the case that we've read earlier, that the patient looks like has an otitis media, now has left mastoid. I'm summarizing it. Left mastoid pain. Now the patient is vomiting. Now the patient is dizzy and very at risk for fall because of vertigo. And you know that vertigo and dizziness is coming from the otitis media, right? It increases the pressure from the medial part of the ear, the canal, and there's no way for that area to expand because anteriorly it's closed by the tympanic membrane. Posteriorly, your bones, right? Your ear bones, right? Auditory bones. When there's collection of purulent drainage there, it pushes both tympanic membrane, hence why you see bulging, and it pushes the bones to the back, increasing pressure to the cochlea, and there's water in cochlea to detect your head position, which keeps moving and moving because of this pressure. Thus, you feel very dizzy. Whenever we have otitis media for kids, for adults, we always see them very dizzy and they're at risk for falls, right? But because of the proximity of the inner ear and medial ear to the brain, can that infection spread out of the ear and start invading your brain surfaces? Yes or no? Yes or no? Yes. So what's your answer here, guys? What's your answer? Oh no. When the infection spreads out of the ear and start invading your brain surfaces, mastoiditis and meningitis. Very good. Hello, care. You guys got it? Autosclerosis is overgrowth of bones. This is usually a complication of past surgical history to the ear. If they had surgical history as a kid to the ear, inner ear surgery, they might have autosclerosis, but this is not related to infection. Remove that. Meniere's is a syndrome. It's another disease where there is an abnormal collection of fluid in cochlea causing all these imbalance and vertigo. But Meniere's is not an infectious process, all right? We're thinking otitis media. We're thinking mastoiditis. We're thinking meningitis. Did you guys understand? You guys understood that? So the answer is meningitis. Agree? Everybody agree? So when you start with your pathophysio with infectious process, you follow that infectious process all the way. Meniere's is non-infectious. All right, it's a different type of disease. It's over collection of fluid. Autosclerosis is not infectious as well. It's due to past surgical history. Are we guys? Do we guys agree with that? You guys agree? All right, let's go to question number 4. Look, there will be plenty of things now on your screen. You guys see the screen? I don't think you can see my cursor because this is StreamYard. All right, let's see your additional data at 9:30. Look at 9:30 at the bottom. Client was transferred to the hospital for further evaluation and treatment. All right. I'm gonna remove myself first from the layout. I don't know how to do that. Here. All right, you guys can still see it, right? But you can hear me? Can you guys still hear me? Yes. I took out my video for a little bit so you guys can see the whole thing. At 10 o'clock, the patient was moved to the medical surgical unit. All right. Client was admitted for otitis media and worsening of symptoms. That's the data. All right. At 10 o'clock, the client was admitted for otitis media and worsening of symptoms. Let's click on the history and physicals tab. Let's click on that. All right. What do we see? All right, what do we see? Start writing down notes. Remember, one of the techniques is to start writing down notes. Ooh, now we have a lot of viewers. Thank you guys for joining. You guys were a little late, but we usually start 8 a.m. Central Standard Time. All right. All right. So again, we're in this case we're talking about a mastoiditis of a 38-year-old female. Let's look at your findings for question number 4. You have alert, oriented, but uncomfortable and irritable, right? In EENT, the patient was admitted for recurring otitis media and worsening symptoms. We don't like recurring otitis media. Like I said, it can lead to mastoiditis and meningitis. Pulmonary, everything looks fine in the pulmonary. So we're gonna skip that. Cardiovascular, there is a fever. The pulse is elevated, right? So we're seeing signs of SIRS. SIRS is systemic inflammatory response syndrome or early signs of sepsis, right? Experiencing vertigo and headache as well in cardiovascular. Look at gastrointestinal, reported anorexia, reported nausea and vomiting, musculoskeletal, reported weakness, genitourinary, voided, that's normal, immunologic, allergy to penicillin and ceftriaxone or cefotaxime, which is probably not related today, and some data in psychosocial, which is actually not really important at this point because we have an acute issue. All right, so now focusing on the otitis finding, all right, and your irritability there and uncomfortability and some of your signs of sepsis here and gastrointestinal issues. What are your things? What are the things? What are the orders that you guys are going to anticipate for this client? Anyone? Arlene already has an answer. How about the others? How about the others? How about the others? What are you guys' answers? So, considering all the data that we've seen so far, do you want to do lumbar puncture? Do you want to do indwelling Foley? Do you want to do airborne isolation precautions? Do you want to do culture and sensitivity of ear, psych evaluation, and computed tomography scan of the left ear? All right. Everybody has answers already. Kim has answer. Kim is the one taking on June 19, right? Good luck to you. All right. We suddenly have a lot of viewers. When I started, there was only 11. I guess everybody came in late. All right. Thank you. All righty. So what is our answer, people? All right. Did we mention meningitis earlier? Yes. Do you want to do lumbar puncture? Do you wanna check your CSF if the bacteria has reached that CSF and do lumbar puncture? Yes. Why did everyone skip it? If you're doing a meningitis workup, you don't only rely on your CAT scans, people. You don't see infection that way. You have to have a culture and sensitivity. You have to have a white blood cell count, glucose check on that CSF to make sure that the bacteria has not reached it, because meningitis is more fatal than your otitis, correct? Because it's going to cause a lot of encephalopathies and comatose and a lot of stuff like that, ICP issues. So lumbar puncture, one, yes. Indwelling Foley catheter, not needed. The patient's voiding fine. The patient is not in coma. The patient does not need accurate INO. Indwelling Foley is not needed. Remove two. Everybody who answered two gets a deduction. This is select all that apply. Airborne isolation. When you were talking about meningitis, airborne or droplet? This is where all the confusion comes from. You see the word precaution and you check it right away. Airborne or droplet? You guys think. For airborne, you only have three, right? MTV, just like your MTV, right? The TV from music television, right? MTV, measles, tuberculosis, and varicella slash herpes zoster if it's the first time. So that's chicken pox, right? Meningitis is droplet. Agreed? Let's remove number three. Everybody who answered three gets a deduction. You are not totally wrong. There is a precaution. The problem sometimes with us is we get word associations. This is one of the techniques I tell my students. We get this thing where we see a word, we associate it with another word, and then we think that's the answer, right? Oh, meningitis. Oh, precaution. Oh, that's one of the answers. But if you think carefully and be very careful with how you answer to select or apply, because it's right minus wrong, you do not do airborne isolation for meningitis. You do droplet. All right? Agreed? Three is wrong. Everybody who answered that gets a deduction. How about culture and sensitivity? Yes, some people did not answer four. But guys, your case is otitis media with purulent drainage and blood coming out. You want to test that or not? You want to test that or not? Yes, you would. All infections, you want to test from the source for what type of bacteria, for, of course, for proper antibiotic management. So one and four, all right? Five, we do not care about psych right now. I know there's grief. I know there's probably depression component, but we're focused on the acute, all right? Remove five. How about CT scan of the head and left ear? Do you want to see how far the inflammation went? Do you want to see how far the exudates went? Yes. So the answers are 1, 4, and 6. Who got this correctly? All right. The others answered two questions and probably got one incorrect. So that's a deduction. You get 1 point, right? But listen, this is total of 3 points. 1 point is still better than zero. Agree? 2 points is still better than zero. Agree? So, guys, this is called partial scoring. Do you understand now why partial scoring will help you pass the NCLEX? Yes? 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 Yes. So, partial scoring is very important. If you guys watch my Dr. Nurse Paul show back in April 28th, I discussed partial scoring system and how it's going to help you during your NCLEX. All right? So 1 point is still better than zero. That's still a plus point for you. Thank you for those who just joined. Please continue to share this on your pages, guys. Can you just do me one very easy favor? If you can just share this to your pages where you're members of, or share this to your groups, please, so we can reach more nurses out. Because I mean, this is free class, and I want to be able to help as many students or as many nurses as I can. All right, guys, let's see. Look down in your chart. Look down in your chart on the left side. I'm gonna turn off my screen. All right, my computer, my video, and it says there at 10 o'clock, the client was transferred to the pre-op, all right, for mastoidectomy. At 4 o'clock p.m., 16 o'clock, the patient is now transferred to PACU, tolerated surgery without complications, returned to medical surgical unit in stable condition. All right. So patient is now in medical surgical unit in stable condition. Let's look at your history and physical. History and physicals are normal. History and physicals are normal. All right. And the CT scan is um hold on, Siri is being activated right now. All right, the CT scan looks like we have negative CSF. All right, negative infection on the CSF, so there's no meningitis, which is good. The CT scan showed abscess, right? Oh, I'm sorry, negative for abscess. There's no abscess, which is good. There's inflammation of the left mastoid bone and large fluid and inner ear and middle ear. So now we have mastoiditis for sure, right? Because of the CT scan, we've seen that there's mastoiditis. Let's look at the lab results. We've also seen that the left ear drainage that we did culture and sensitivity earlier, the results are still pending. So what's key information here? The key information, did you guys see how we flipped through the tabs? That's what you do in your NCLEX. You make sure that you flip through all the tabs, even if you think you already know what's going on. All right. You see the history physicals is the same, but I still clicked it. Why? Because there might be something new in that information. All right. In that tab. All right. Now, so look at this, guys. The nurse has reviewed the progress notes. All right. From 10, 16, and 11 o'clock, 13 o'clock, lab results from 18:30. For each potential nursing intervention, tell me if it is indicated or not indicated. All right. There's only one answer per row. What are your indicated managements? Keep the client supine for 24 hours. Indicated or not indicated? 24 hours. Have you heard anybody that we put on supine for 24 hours? I think you're putting the patient at risk for DVTs and pneumonia here if you haven't been turning that patient that long, right? In the hospital setup, they're going to get DVTs here. Agreed? Especially post-surgery where they are hypercoagulable because you cut them open and they're starting to bleed, they're going to get clots, right? Not indicated. When you put them on supine after lumbar puncture or even head surgery, couple of hours, 4 to 6 hours in some books, 6 to 8 hours in some books. It doesn't have to be that long. 4 to 6 hours is the average now because we're also preventing DVT, all right? For lumbar puncture, we do this to prevent headache from the epidural leaks, right? For head surgeries, we do this to prevent ICPs, but we do not put them on supine. I'm sorry, not supine, all right? For ICPs, it's semi-Fowler. So we're doing the supine because of the lumbar puncture, right? And we did that prior to the surgery. So, but not 24 hours, all right? If they had epidural anesthesia, it's only 4 to 6 hours, 6 to 8 hours. As soon as they can tolerate sitting, they sit. As soon as they can tolerate, moving their legs and standing to the side of the bed without risk for fall, then we do it. But not 24 hours. So not indicated. Assess for bleeding. Indicated, obviously, because it's surgery, right? Administer antiemetics to prevent vomiting. Imagine if you have surgery here, all right, inner ear, middle ear, I'm sorry, and then mastoid, and we drained it, all right? There's mastoidectomy. Do you want to relieve the pressure? Yes, you don't want pressure there, right? So vomiting, coughing, right? Bending, lifting. Can this all increase the pressure on that site? Yes or no? Yes, so these are contraindicated, right? So we need to give them antiemetics so they won't vomit. So again, antiemetics, the third option is indicated. And reinforce the importance of coughing. Coughing. No. They can also not go to the water source. No water there until the doctor cleared. So no swimming. If they're going to shower, they have to cover it with Vaseline gauze to prevent water from coming in, or shower cap. All right? No water, no coughing, no bending, no straining, no lifting, no vomiting. All right? Anything that can increase the pressure. It's a very tiny piece over there. It can rupture. Okay? So again, the answers: keep the client, not indicated. Assess for bleeding, indicated. Administer antiemetics, indicated. Reinforce importance of coughing, not indicated. All right. I think we're in the last question. You guys are ready for the last question? You guys are still learning with me? It's a very, very long case. In fact, there's more information. All right, let's see. I'm going to take out my video right now. Look at the bottom of your left screen. It says here, day 15, all right? Discharge client to home with post-surgical instructions. Follow-up appointment is scheduled in 1 week. Scheduled in 1 week. All right? Scheduled in 1 week. You guys ready? All right, so that's it. It's the case now is the patient just being discharged, scheduled in 1 week. And then to cut down the time, I already checked all the tabs. All the tabs look normal. There's nothing to change. I'm not gonna open them anymore. Okay. So, but all the tabs look perfect. They are perfect. I mean, not perfect, I'm sorry, but there's no new information. But during your actual NCLEX, even if you feel like there's no new information, you still want to click on them out of the abundance of caution. All right. I'm not going to do it right now because we're cutting down time. We're going to wrap up in the next 10 minutes. But you have to click all the tabs to make sure there's no new information. Do you guys agree? That's one of the tips I always tell students. Out of the abundance and the of caution, I always tell my students during NCLEX, you should be a little OCD. You see tabs, you click it, even if you think you already read it. All right? Just to be sure. Because sometimes they would add 1 or 2 lines at the bottom or to the side. All right? Anyway, I already checked it, guys, for you, and there's nothing. We're going to cut down time. We're going to go straight to the question. The question is, you tell me if it is understanding or no or incorrect understanding. Understanding or no understanding. You guys ready? Understanding or no understanding. Understanding or no understanding. You guys ready? The first one said, I should avoid blowing my nose. Understanding or no understanding? Understanding or no understanding? This is understanding. Very good. Because I said no blowing of nose, no coughing, no nothing to increase the pressure until the doctor says you're clear. They're gonna check if the sutures are already fully healed. All right. So how do we prevent blowing of nose then? We give them decongestants. We give them fluids to relieve those pressures and prevent those clogs. All right. Decongestants, expectorants, anything that can prevent coughing and congestion. All right. How about I will experience some permanent hearing loss? Understanding or no understanding? Let me tell you this, guys. If the doctor says I'm gonna operate you, but you're gonna lose your hearing, are you still gonna go, guys? We have more viewers. We now have reached more than 100 viewers, and I'm already about to end. Didn't I tell you guys at the beginning that we usually get more viewers towards the end? I started with only 11. It's funny. All right. Anyway, but guys, I'm sorry for those that just came in. This is recorded. We're wrapping up in 5 minutes. So please watch this video after I wrap up. It's going to be posted straight into my YouTube or Facebook. Go to my YouTube because in YouTube, we put it in a playlist. In Facebook, I already have so many videos there and your guys are going to get confused. All right. Okay. So understanding versus no understanding. Blowing of nose, understanding. Permanent hearing loss. If the doctor tells you, I'm going to operate your ear, but you're going to have permanent hearing loss, are you still going to let the doctor operate on you? No. The permanent hearing loss is a very rare complication if the infection already spread and damaged the nerves. Very rare. All right. Usually, the loss of hearing is because of pressure. That if the doctor relieves that pressure via surgery, the hearing loss might recover or the patient might recover eventually. So the hearing may return once the pressure is relieved. All right. So this is no understanding or incorrect understanding. Again, second option, no understanding or second item. Third item, I should check with my physician before traveling by air. Air pressure, air pressure, air pressure. We don't like that, right? It can damage the suture in the inner middle ear. So understanding, understanding. How about the fourth item? I stopped taking anti-infective as soon as I no longer have pain. We tell patients you always, 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 always finish your antibiotics, right? You always finish your antibiotics even if you feel better. Agreed? So that's not understanding or no understanding. That's incorrect. It should be incorrectly understood or something. All right. Michael said, sorry, Sir Paul, I just finished changing the diaper with my son. Thank you for joining, guys. I know a lot of you guys are busy or at work or with your families. This is Saturday night. Thank you so much for always spending your Saturday night with Sir Paul Saturday morning here in the US. All right. Thank you guys for joining. Your commitment shows your level of passion and commitment to pass the NCLEX. So thank you guys. I should not shampoo. How about the last one? So again, stop taking anti-infective is not no understanding. It should be finished completely. All right, not stop when you feel better. How about I should not shampoo my hair until my physician instructs me to do so? This is a correct understanding. Correct understanding. Right. Because chemicals can, especially water, right? Shampoo, you need water to use that, right? And it goes to the ear, causes infection, chemical reaction, chemical irritation. We don't like that. We tell patients you have to get your surgeon's clearance before you can start using shampoos and all that, right? Because it might cause chemical reaction there. They can shower, yes, but no water on the ear. So we just tell them just shower cap. If you're gonna shower, don't go to the bath. Bath is in the States, when we say bath, it's bathtub. First world problems. We don't have this in the Philippines. Well, I now have my bathtub in my house in the Philippines, but growing up, we didn't have this. We used tabo, which is water dipper, right? All right, but in America, people have bathtubs. So tell them don't go to the bath, because when they say they go to the bath, they go to the bathtub and sink there, and it goes to the ear. No water in the ear. Okay. So again, first item, avoid blowing nose, understanding. I will explain some permanent hearing loss. No understanding. Check with my physician before I travel again. Understanding. Anti-infective as soon as I no longer have ear pain. No understanding. And not use shampoo until my physician instructs me to do so. Understanding. All right. There you go. We've completed the case study for today. All right. You guys, was that helpful? Was that helpful? Yes, was that helpful enough for everybody? I hope you guys enjoyed the lesson for today. I gave some tips in the middle. If you guys haven't watched this at the beginning or didn't catch it towards the start, this is recorded in my YouTube. If you guys can please go to my YouTube channel and share it to your social media pages, tag your friends. There are playlists on my YouTube. All right. My social media team does a very great job to organize these things for you guys. So much resources, so much wealth of information that I share over there. All right. So, guys, all right. Thank you for joining me today. And again, can you pass your next gen NCLEX? Can you pass your next gen NCLEX? Yes, you can. All right. So that's it. Thank you for joining. If you guys are interested, we are still giving discounts in Aspire RN. Message my team right now in the Dr. Nurse Paul's Facebook page or Aspire RN Facebook page. And one of my team members will get a hold of you and give you discounts. All right. Sometimes we don't publish the discounts, but if you message us right now in private, message in the page, okay? In the page, my team members will be able to help you. All right. Some of my team members can give you codes that you guys can use for discount. So if you have friends as well that you want to refer to Aspire RN, let us know. We can help them. We can also give you some forms of referral fees if you guys are interested with that. But I'm here to help our international educated nurses succeed. And you guys, thank you. We have students from all over the world. We're not only handling Filipinos. We have students from 40 countries. We have students from Central America, Southern America, African region, European students, American, Canadian students, and Australian students. So we're all over the world. Aspire Art is the only global, truly global NCLEX provider. And thank you guys for supporting Dr. Nurse Paul. And again, guys, we want to invite you on my future shows. All right. Don't forget my future shows. All right. And the schedule is right there on your screen right now. All right. Today is the case study. On Saturday, I will be live streaming straight from London. And we're going to talk about English exams and why is it important for immigration. Not only for US, also for UK. If you're immigrating to Australia and Canada, English-speaking countries, you would need English exam as an immigrant. We're going to talk about that, and we're going to have free English lessons after the show. All right, so watch out. On Saturday, we're going to bring in 9.0 Niners June 10. I'm streaming live from London. All right, and on June 17, we're going to come back with a case study again. All right, if you guys enjoyed the case study today, please make sure to tell your friends about it. Follow me on my social media, Dr. Nurse Paul and Aspire RN, so you can get notifications when we put out these calendar events and put interested whenever we put out those calendar events. That way it notifies you when we start. All right. We also stream this in Facebook and LinkedIn. So please follow me on LinkedIn as well. And I'll be streaming that live case study on June 17th in Copenhagen, Denmark, or Copenhagen. I don't know how to pronounce it correctly. June 24 is my final show for June. This is every Saturday again, 8 a.m. Central Standard Time, guys. Understanding Job Offer with Ron Hope, and I'll be live streaming that from Louisiana. I'll be all over the place in June because I didn't travel back in May because I focused with you guys. I stay put in my home, although I love traveling every month. I didn't go anywhere for May because I need to stay put because we mounted a lot of shows and I want to be in a controlled environment while doing this Nurses Month special. But now the Nurses Month special is over. I'm going to gift myself a Nurses Month special for myself, which is a little late, but I'm going to fly to Europe and then Louisiana for a nurse practitioner conference. All right. If you guys are in any of these cities that I'm going to, London, Birmingham, UK, Copenhagen, Denmark, Oslo, Norway, and New Orleans, Louisiana, let me know. I want to collaborate with you, do a little interview so I can put a content about you, about your success, about your American dream. Thank you guys for continuing to support Dr. Nurse Paul, and we are going to see you next Saturday live from London. You guys have a great weekend. Bye.
You have just watched the Dr. Nurse Paul Show. Watch us live every Saturday, 8 a.m. Central U.S. Time. For more info about our future events, follow us on our social media channels. You can find us at Dr. Nurse Paul on Facebook, Instagram, TikTok, and YouTube. See you next week.